Welcome to Breakout Session A, Eating for Healthy Eyes, Nutrition and AMD with Dr. Anna Ells. Just a little bit about Dr. Ells. She is an ophthalmologist with advanced training in both retinal disease and pediatric ophthalmology. She is a clinical professor, Department of Surgery at the University of Calgary, and an accomplished researcher and teacher. She is currently leading several clinical trials for eye disease treatments and has published numerous scientific papers and presentations. So please help me in welcoming Dr. Ells.
Thank you very much. I can see some familiar faces in the crowd. Hope you're enjoying the day. Thank you very much to FFB for sponsoring such a fantastic day. So in 20 or so minutes, I'm going to try and cover some tips and hopefully some recommendations that can help you in your nutrition and how you approach nutrition for AMD. It's quite a complicated, interesting subject, so I'll do the best I can, and then I'm hoping that we have lots of time for questions so that we can try to uncover some of the nuances and help you understand this a little bit better. So this is going to be a talk about a new paradigm approaching and maintaining eye health. As we've learned today, AMD is deterioration in the macula, which is a small area in the center, or what I call, and my patients are aware of this, I call it the bullseye of the retina. So the retina is a very, very large, thin membrane that lines the entire back of the eyeball. But the part that is affected by AMD is called the macula or the bullseye. And in patients with AMD, central vision is compromised or sometimes lost, particularly their ability to discern very, very fine details. AMD is a leading cause of vision loss in Canadians over the age of 50. More than 1 million Canadians have AMD. Almost 200,000 new cases are diagnosed each year. Whoops. Sorry. 90% of new cases of legal blindness in Canada are the result of AMD. The quality of life in patients with AMD is significantly affected, as many reports that they can no longer drive, read, or recognize faces. So these figures and epidemiology are really staggering. What is involved with the loss of vision function related to AMD? There's decreased mobility, increased risk of injury due to falls, loss of driving privileges, loss of independence, and sometimes depression. So loss of visual function has a significant impact on the lives of patients and their families. What are the risk factors for the development of AMD? Well, of course, advancing age is the most significant risk factor, and Dr. Williams and Karani have already touched on most of this, but we'll just review it again here. A family history of AMD is also a risk factor. Genetic factors we know are becoming more and more important in understanding AMD and the progression of disease and treatment strategies. Blue eyes are a risk factor, hypertension or high blood pressure, cardiovascular disease, that means hardening of the arteries, heart attacks, coronary artery disease. Lipid abnormalities, cholesterol abnormalities are also a risk factor, and smoking is a risk factor. So you can see that some of these are modifiable. We can stop smoking. Some of them are non-modifiable. Some of us do have blue eyes. And this is a simplistic patient's point of view. So macular degeneration affecting the bullseye affects the central vision and causes distortion. And that's why many of you will recall that we do ask about monitoring your central vision because you can detect changes in your central vision sometimes sooner than our equipment in the office. There are two types of AMD, a dry form and a wet form. And Dr. Williams has talked about this. 85% is the dry form. However, 80 to 90% of vision loss is from the wet form. Why were there large studies, and why did we want to study nutrients in age-related macular degeneration? It's a very, very interesting history. But in brief, in the 1990s, there was increasing evidence coming out of small reports to suggest that the importance of dietary supplements to support the retina and could possibly play a role in preventing progression of AMD. These were small studies, and they looked at some vitamins and trace minerals that we know are important in retinal cell function. So retinal cell function, those are our vision cells. And they have important structural support. But there was no large, well-designed studies to provide standardized dietary recommendations to our patients. So there was a large study then deployed called AREDS, Age-Related Eye Disease Study. It took many, many years to design, fund. It was funded by the National Eye Institute in the United States, and there were thousands and thousands and thousands of patients in this study. And the purpose of this study was to answer this question: can high dose, so we're talking high dose, antioxidants, vitamins C, E, beta-carotene, and zinc, slow the progression of AMD and AMD-associated vision loss? It was a big question. And why were these nutrients chosen for AREDS 1 and 2? There were 2 studies. Well, vitamin C and vitamin E are powerful antioxidants and anti-inflammatories, and they're found in fruits and vegetables. Almost all cells, not only in our eyes, but also in our body, are dependent on these supportive antioxidants. Beta-carotene is a provitamin A, also found in vegetables and fruit, and is a precursor to vitamin A, and again, an essential component of our vision cells. Zinc is an important trace mineral, and in fact, it's, I think, one of the leading trace minerals in our body, and it has a very important supportive and anti-inflammatory effect on our retinal cells. Omega-3 is a polyunsaturated fatty acid found in high concentrations in the retina, and again, important in structural components and function of our vision cells. They are also anti-inflammatory. Omega-3s are found in fish, nuts, flax seeds, just to name a few. Lutein and zeaxanthine are called dietary xanthophylls, and they're concentrated in the vision cells within the macula, and they have a protective role. They are found in kale, spinach, red peppers, and broccoli. Those are where the highest concentrations are found. All right, so let's look at these 2 major studies that have contributed greatly to our understanding of nutrition and AMD. So the first study was published in 2001, and the formulation, so it was a recipe, and it was based on previous science, and it looked at vitamin C, vitamin E, beta-carotene, and zinc. And I'm just going to give you the bottom line here. It looked at the different severities of AMD patients from no AMD, but with a family history, to early or mild AMD, to advanced AMD. And in patients with no AMD or only mild AMD, there was no benefits with taking this recipe or cocktail of vitamins within the 5 years of this study. In patients with moderate to severe AMD, including dry advanced AMD and wet AMD, up to 25% of these thousands of patients in these studies had a 25% risk reduction in developing advanced AMD. So this was really powerful information, not just for the ophthalmic literature, but this was one of the first studies in all of medicine that looked at vitamins in this kind of capacity, really as a treatment. So when we say, there's no treatment for dry AMD, we mean there's no medication that you write a prescription for, but we really do have a treatment for AMD, and it's inside our refrigerators, and we can buy it as well in capsule form. So then why did we do another study? Why did National Eye Institute do a second study? Well, this was published in May of 2013, and there were some additional questions and additional information about other nutrients in our diet that may help decrease the progression of AMD. So the question in the second ARED study was to determine whether adding lutein and zeaxanthine, those are the xanthophylls, and omega-3s to the original formula. So it's taking the original formula, adding these two additional components. The question was, would this further decrease the risk of developing advanced AMD? In the interim 10 years since the first AREDS study, we began to learn more and more about some of the risks of taking beta-carotene in smokers. So they also looked at taking beta-carotene out of the formula. They also looked at two concentrations of zinc in the second study, and this was because zinc is the part of the recipe in the vitamins that makes some patients have an upset stomach. And that's why we often suggest that patients take these dietary supplements with their meals, because it can upset their stomach. And so the question was, well, if we lower the dose from the original formulation of zinc, would that be better tolerated by patients, and would this still hold the same protective effect? The second difference in the second study was that only patients with moderate to advanced AMD were enrolled in this study. And there were 65% of patients that had dry AMD and 35% of patients had wet AMD in this study. And what did we learn? Well, we learned that adding lutein and zeaxanthin had an additional 10% reduction in the risk of progression to advanced AMD. So significant information to what we already knew from the AREDS 1 study. And what they further were able to delineate in this study was that patients that came into the study with a very, very low diet in luteins and zeaxanthins, so patients that didn't eat any vegetables or didn't have access to these leafy green vegetables, they had an even greater benefit by taking these dietary supplements that had additional lutein and zeaxanthin. So a little bit more about the beta-carotene and lung cancer. So in the 1990s and early 2000s, the medical community learned that beta-carotene was shown to double the risk of lung cancer in former smokers. So the recommendations that came from AREDS 2, the second study, was to eliminate the beta-carotene from the AREDS supplement, the original recipe. And lutein and zeaxanthin may be an appropriate substitute for the beta-carotene, as they showed no increased risk for any adverse effects, including lung cancer. And what is the role of zinc? Well, they looked at, as I mentioned, the two different doses in the study, and they found that there was no differences observed in the risk reduction from a low dose to a high dose. But NEI recommended that there was still insufficient evidence to change the actual dose of zinc, given that it had no associated systemic risks to the patient. So based on the original study, the dose of zinc remains unchanged. So you still may have to take it with your meals. What is the current role of omega-3s that we've learned from the AREDS study? Remember that omega-3 is the anti-inflammatory that's very concentrated in fish and flaxseed. Well, the reason AREDS 2 looked at omega-3 was when they teased out some of the original data from AREDS 1. There was a questionnaire that patients filled out, because remember, there was no omega-3 in the first recipe. But in the survey that patients filled out in this study, patients were asked about how much fish and omega-3s they ate. So when they looked at those patients that had a very, very high dietary intake of fish and omega-3s, those patients showed a 30% less likelihood of progression of disease than the other patients. So that's why AREDS 2 added omega-3 to the study to see, well, if we give everybody omega-3, will this further reduce the reduction of disease? And this is what they found. They found that in AREDS 2, there was actually no improvement or change in the progression of disease. So what are the key findings of AREDS 2? That omega-3 to the AREDS-like supplements did not further reduce the risk of progression of advanced AMD, and there were beneficial effects that were observed in patients that received lutein and zeaxanthin, especially if they had a diet very, very low in these vegetables. So the National Eye Institute recommendations are very clear. First of all, we look at our patients, and we look at whether or not they smoke. So we look at their modifiable risk factors and their non-modifiable risk factors. We recommend that they don't smoke. We recommend that they have a very, very strong diet. The best way to take these vitamins is to ingest them. The best way for our retinal cells to absorb these nutrients and trace minerals is to eat them in the food in which they live. Lifestyle is incredibly important, and it can be walking 10 minutes every day. It can be moving your feet in a swimming pool. And then the last thing is to manage other systemic problems that go along with patients that have AMD. They do have hardening of the arteries. They may have high blood pressure, so it's important to have all of these things controlled. AREDS 2 reinforced the importance of daily oral supplementation, and the recommended AREDS 2 formula reduced the risk of progression to disease to up to 26% over a 5-year period. So this is really significant. The improved safety of AREDS supplement occurred by removing beta-carotene to decrease the risk of lung cancer in patients that were smokers or former smokers, because you carry a 10-year history of that chance with you as a former smoker. Lutein and zeaxanthin appear to be appropriate substitutes for the beta-carotene in the new AREDS formulation. And the dose is, somebody was asking, I think, earlier in the session of the dose. So the recommended dose is 10 milligrams a day of lutein and 2 milligrams of zeaxanthin. So this is what the new cocktail looks like, and these come in 5 or 6 different companies make these, and more are coming, I'm sure. So there's a vitamin C, there's vitamin E, lutein, zeaxanthin, zinc, and copper. Copper is in there because zinc can actually decrease the circulating amount of copper. So the copper is just added because of the potential side effect of zinc. Then just to complicate the program, recently in 2014, there have been better studies that have showed that depending on potential genetics in AMD, some patients with certain gene mutations may benefit from omega-3 supplementation in their diet, and others may not. So this, I just want to say, I wanted to point this out just to show you that we really don't have all the answers in omega-3. AREDS 1 and 2 also looked at some long-term benefits, and after the original 5-year AREDS study that ended in 2001, participants were followed for an additional 5 years, again, mostly to look at safety of these vitamins. Patients are taking, remember, these are high-dose oral supplements. They showed a significant reduction in mortality, which is death and dying, was noted and accounted for by the reduction in cardiovascular deaths. That's mainly heart attacks and hardening of the arteries. In patients randomized to zinc. So what this showed was that zinc was really helpful in helping us live longer and making us a little bit more healthy. However, the recommendation was further investigation is warranted in looking at zinc, and that dietary supplements in this advanced recipe had no significant effect on mortality. So we believe this to be safe. So the recommendations, again, are daily high-dose AREDS 2 formulation to help slow the progression of AMD. And this is supported by the American Academy of Ophthalmology and the Canadian Ophthalmology Society. General recommendations that I'd like to close with are to counsel patients on stopping to smoke, discourage beta-carotene supplementation in former or current smokers, reinforce the value of a healthy diet to promote eye health and general well-being, and considering the big picture with nutritional supplements, which may be indicated in moderate and severe AMD. Omega-3s may be considered to help prevent AMD in some patient population, to emphasize the importance of regular dilated eye examinations, encourage the regular use of an Amsler grid to monitor vision changes, and to remind patients to protect their eyes against ultraviolet light, which we know is toxic to the retina. We don't have all the answers. However, AREDS 1 and 2 have really helped us understand what we can offer to our patients with age-related macular degeneration. There are some limitations with the science, as always, but these two studies were really significant in the contribution to our current knowledge. AREDS 2 was both were robust studies, and there is no plans to conduct a third trial. So this is the state of the union as we know it. So thank you again. Thank you to patients, and thank you to FFB. Thank you. Are there any questions?
When my husband first was diagnosed with AMD, I ran out and bought a Jack LaLanne juicer, and we did use it for several years, and I did it every day, but it is a bit labor intensive, and I just wondered if there's any benefit to using something like a Vitamix for kale. I mean, kale is not something that we like to have every day to eat, and so in order to get this into your diet, is it more beneficial to have the fiber in the skins, and like you can do with a Vitamix rather than the juice alone? Yeah,
so there isn't a large clinical trial that compared Vitalix to the AREDS formula. However, we know from our nutritional colleagues that ingesting the vegetable and the fruit and the fish, and meat has many of these things in it as well, is the most natural and healthy way. And we absorb, our gut, our bowel, absorbs it best when it comes in its original form, fresh, uncooked. So, I agree it's labor intensive to do those sorts of things, but likely those work.
Can you tell me the recommended dose of Vitalux on a daily basis?
So we're trying to stay away from any brand names. So, no, that's all right. That's all right. That shows how well they're branded, because we do the same thing, and we don't. We shouldn't say Vitalux. So I try to say AREDS formulation. But now there are so many generic forms, and you can buy these vitamins everywhere. So I can't actually give you a dose because it depends on what bottle, what make. But the instructions are on the box, so you do have to read the label. And often it's 2 capsules twice. You mentioned Vitalux. Vitalux was 2 capsules twice a day, and the reason and they're big capsules, difficult to swallow. But a lot of that was with the omega-3. Now that they've taken omega-3 out of the cocktail, the capsules are smaller, but it's still the doses you should read the label.
My question has to do with nutrition and other macular diseases or retinal diseases. We have heard a lot of these supplements mentioned with regard to RP and some of those diseases. Would you have any comments if there's a study going on for those, or in your own practice, what would you recommend for people that have other retinal diseases?
Yeah, that's a great question. And where is Ian McDonald when we need him? So Ian actually and his group in Edmonton have studied some, in particular, omega-3s for their RP patients, Stargardt's disease as well. But again, the studies that have been published are small and inconclusive to date. But what I advise my patients is to eat a healthy diet that's balanced in these nutrients that we know are important in retinal cells. And I didn't talk a lot about this due to time, but these are all important nutrients that are in they're in the cells and important to the cell function. But as we get older, and then you add a degeneration on top of the age, we have less of them in our cells, and many of them we don't make. We don't make these fat soluble vitamins. We have to ingest them. So this is what I tell the patients, is that we know that we need these vitamins and nutrients for our cells. We know that we're running out of them. so the only way to get more is to eat them. But the science is not as good as it is with AMD. We have great science to support what we recommend to our patients with AMD.
At what age is it recommended to start these supplements?
That is a great question. So it's not age. It's not based on age. It's based on your level of macular, or the severity of your macular degeneration. So remember, AREDS 1 showed that patients without AMD but had a family history of AMD and mild AMD had no benefit. But what I recommend to those patients is that they wear sunglasses and they have a healthy lifestyle, and they eat all of those vitamins. So there isn't an age. It's all to do with your level of severity of disease. Oh, sorry. The question is, should the daily amount of lutein be more than 10 milligrams? And we don't have the science, but more is not necessarily better. It can accumulate. We have more science on vitamin A and its toxic effects, but we don't have a lot of good science on lutein. So all we know is that these amounts have been studied and they work.
Has the FDA approved these high levels of supplements?
Yes, they have.
Okay, so what you read on the box is what you should do?
Yes.
Okay.
So we know that those supplements are good for you. Yet my doctor does not want me to take them. This is my retinal consultant that treats me. And my other question is organic or non-organic as far as foods?
Yeah. I can't speak to your personal situation. What I didn't talk about was contraindications to vitamins. And I think I was hoping somebody was going to ask me this. Your question is a great question. So not all patients should take all medication. And this is a medication. So when you go to your family doctor, when you go to have a surgical procedure, when you go to the dentist and they ask you for your list of medications, you need to include this. Because we know that the AREDS formula can make anticoagulants last longer. So whether that's Coumadin, Plavix, aspirin. So it increases the clotting time. We know that AREDS formula actually makes anti-inflammatories like Advil. It protects us from stomach ulcers. So it has some good effects and it has some adverse effects when combined with other medication. So this is a medication. This is a drug. And when you take it in high doses like this in a tablet form, so not all patients should be taking these depending on what their history is and their medication includes. And your second question was organic or inorganic. Well, probably organic. I think the less additives that we ingest, probably the better, but I don't have a trial to support that.
I think you've likely answered my question, but my friend in Arizona said everybody over 50 should be taking eye vitamins, and I'm wondering if when there's the gene in the family, if it would delay it or prevent it if they start taking the vitamins early.
Yeah, so the larger studies have not shown that. They actually did look at that, and they did not show that. So we don't recommend the high dose formula to patients with non-severe AMD. However, I think that it is important that we all eat kale, and I think there is evidence in the literature in multiple small studies but significant studies that show that when we ingest these nutrients, they're anti-inflammatory. They mop up those free radicals that are killing our cells and all of us as we age, and there's so much evidence to support antioxidants, and if we eat this in a natural way, I think it'll benefit us all.
Yeah, I've been taking Vitalox with omega-3 for a few years now, and I got a big supply. Did I understand?
So does my mom.
Did I understand right that misunderstand taking omega-3 out of the Vitalox?
Yes.
They are taking omega-3 out.
It is now not included in the AREDS 2 formula. That is correct, because it was not shown to have an additional benefit. It's not that it was harmful, but it costs more to put it in. The omega-3, so many patients are on blood thinners. There's a drug interaction. There are many other drug interactions specific to omega-3, but omega-3 wasn't shown to be harmful in these patients. But it wasn't shown to make an additional benefit. So you can still use up your
1 year supply.
Your 1 year supply. Yes. My mom's trying to get the back-ordered stock, actually.
No, I was just wondering if the spinach and kale is supposed to be so good for you. What damage do we do to that by cooking it?
Yeah, so that's similar to the Vitamix. Is that what it's called? That expensive, fancy machine there? I have to get one of those. So the nutritionals, our nutritional colleagues, say that it's best to eat them fresh and uncooked. There are still some of the vitamins and enzymes are protected through the cooking process, but not as much as they are in the fresh state.
Is AREDS 2 also known as PresserVision?
Yes. Okay. So I stayed away from the names on purpose, but I said AREDS a lot. So on purpose. So what you need to remember is you need to remember AREDS 1 and 2, AREDS, or now it's AREDS 2. You can't, so you just, as long as it says somewhere on the box, AREDS 2 formula, you're good.
For those of you who dislike kale and or spinach, if you dice them and put them in smoothies, and they're a fantastic addition to salads, and you don't taste the kale.
Yeah, I agree. What I do, I love kale, but my kids don't, and so I just cut out I think what they mostly don't like is that thick piece in the middle. So you can cut out with your dicing knife. You cut out the center, and you can actually cut out some of the fibrous branches as well. And then I cut it really, really finely, and I mix it with romaine lettuce as well to disguise a little bit. And the recommended amount of lutein in the AREDS is in 1 serving once a week of kale. I looked that up for you guys.
Hi, my question is, there are any benefits of blueberry or bilberry?
That's a good question. I was hoping somebody was going to talk about the berries. So the berries, bilberry, blueberries, raspberries, they have a very, very powerful antioxidant capability, as shown in animal models and in plant models. However, they're not well studied in humans. We don't know if the retina absorbs those dietary components, so it's still unknown. I actually did a study with the University of Oklahoma on bilberry, and it's not published yet, but what we did with rats in an AMD model was we made sure we fed them bilberry, and we made sure that they were absorbing bilberry, and we measured it in their blood, and we dissected their retinas, and we did electrical studies on their retinas, and we showed no accumulation of bilberry in their retinas. So, that's just my one study. But so the evidence is very, very, very unclear for the berries. However, we know that they're powerful antioxidant. They're good for our skin. They're good for our heart. They're good for our blood. So it's not to say that you shouldn't eat those things, but the science is not as strong.
Yes, I'm wondering if there's been any studies
or any correlation found between all the additives and chemicals put into packaged and prepared foods?
Not with AMD that I know of.
Yeah, because we talk about all the good things.
I know,
but how
yeah,
much of the
I
bad
agree.
things are we getting?
I agree. Yeah, I agree. And you know, I appreciate your question, and that's why I think like eating in a healthy way is just so important, and to eliminate those processed foods and additional compounds that may be adding oxidative stress and inflammation. It's all inflammation. Aging is inflammation. AMD is inflammation.
Sorry for giving you a very politically affected question.
Oh, no, that was a good question.
I was wondering how much kale should one take every day, and do you need fat? Like, is it fat soluble? Do you need to take fat with it?
You do not need to take none of these vitamins. Most of them are fat soluble. Some of the some of the xanthophylls are water soluble, but you don't need to ingest them with other things. Your gut will absorb them all on their own. And as I mentioned, one serving of kale per week is equal to 10 milligrams of lutein per day. So, okay, thank you very much.